Good morning, our Uganda team. It's good to be back with you again. We've been talking about acid disease in the stomach, what we call peptic disease. And so today I want to do some teaching about acid disease in the esophagus, what we call esophagitis or GE reflux, or actually ulcers could be in the esophagus as well. So let's go ahead and get started. And then at the end, I've got some exciting news for you. Peptic disease can occur either in the stomach or the duodenum or in the esophagus. So really, when we talk about a problem with acid, it could be in any one of these three locations. Pain from peptic disease or acid troubles can occur in the abdomen, like this patient, but can also begin to be in the lower chest because of reflux of acid. It can move up into the upper chest, and in fact, sometimes we call it heartburn because it mimics the kind of pain we get with heart troubles. And finally, the pain can actually move all the way up into the throat. It can even cause acid to be tasted in the back of the throat. We call this taste of acid in the back of the throat acid brash. Last time we talked about ulcers in the stomach, what we call gastric ulcers. This time I would like to focus more on esophagitis and ulcers in the esophagus. You can see in these pictures ulcers in the lower stomach, what we call the antrum. Let's turn our attention now to the esophagus. This picture is taken looking up at the top of the stomach where the esophagus enters into the stomach. The scope is coming through that opening. The small white spots that you're seeing in this picture are not ulcers, but just the reflection of the light from the scope itself. Experts tell us that as many as 20% or 1 out of every 5 patients have difficulty with acid, which flows out of the stomach and up into the esophagus. The esophagus can actually be burned by this acid, causing what we call esophagitis and sometimes actually burning ulcers in this region. So how do we know when a patient has epigastric or chest pain if it's coming from esophagitis or esophageal ulcers, or if it might be heart pain? So once again, here we are needing to get a good history from the patient. If the patient has pain when he bends over, or pain after he eats a big meal, or discomfort after he lays down to sleep at night, or if he's having difficulty with coughing, these all represent clues that his pain is probably from reflux. Chest discomfort that comes with exercise is oftentimes a clue to pain that is coming from the heart itself. The patient might complain of pain when they walk uphill. Shortness of breath is a symptom which can occur with either reflux esophagitis or cardiac heart pain itself. Chest pressure and nausea are symptoms which can occur in either esophageal disease or in heart disease, and so it's hard to use that symptom as one that distinguishes between the two. If you're dealing with a hypertensive female patient who is having chest pressure, be careful. It might be heart disease. Now, in conclusion, I want to show you a few pictures of ulcers in the esophagus. Here are some severe ulcers looking at the opening into the stomach. This one shows multiple small ulcers in the lower esophagus. Remember, the white spots are where the ulcers are located. This next one shows a particularly deep ulcer with a rolled edge in the lower esophagus. This rolled edge is worrisome and may actually represent an ulcer which has been chronic and developed into a cancer. Remember that acid washing into the esophagus over many years can cause a cancer to develop. The incidence of esophageal cancer is high in Africa. So now you've had a little introduction to esophageal disease and also to the importance of taking a good history when you're talking to somebody who is having abdominal or chest pain that you think might be reflux esophagitis or ulcers in the esophagus. So it made me think of a verse that I sometimes think about when I see a verse in the Bible that I think is particularly true. I write it down on my phone. And so it made me think of a verse, Proverbs 18:13, which says, "To answer before listening, that is folly and shame." And so that's true in life in general, and particularly true in medicine, is that you have to be a good listener before you start answering and giving solutions and prescriptions. Because if you answer before listening, that's folly, foolishness, and shame, because you're going to miss what's going on and make the wrong diagnosis and prescribe the wrong treatment. So anyhow, I just share that to hopefully make you think a little bit about what you're doing in medicine, and also think about what you're doing in life. I hope that you're taking time to read your Bible and think about what's in there. So the good news I wanted to share was that the butterfly came yesterday to the house here. So we're have it here. We just got to figure out a time to get it to you folks. But it is here, and so we'll be ready to get you going on some ultrasound. And so I know that Oscar and Doreen have agreed to be the initial ones, and so I've asked them to do some training and to find somebody that we do what we call shadowing, which means to look over their shoulder and learn something about ultrasound while they are actually doing an ultrasound. And maybe if they're willing, even let you get the hands on the probe a little bit after they've done the ultrasound. And so anyhow, that's the good news that's coming, and hopefully we can get it to you sometime in the future. Probably next video we'll talk a little bit more about the 7 things that contribute to esophageal disease in particular. There are 7. I've already given you 1 in one of the videos, if you can think about what that was. And we'll go through the other 6 so that you'll know to watch for those and help you sort that out as well. So, looking forward to talking to you again. Take care. Love ya. Bye-bye.